Do you have pain that starts in your neck and shoots down your arm? Maybe it's tingling or a numbness sensation. You might have weakness in your shoulder or gripping things. You might drop things frequently. You might even have pain into your shoulder blade or into your head. If you're experiencing any of these symptoms, you might be suffering from a pinched nerve in your neck. The technical term is called a cervical radiculopathy. In this video, I'm going to show you my favorite 6 stretches that can help you get rid of those symptoms in the comfort of your home. My name is Dr. John Saunders, and in this video I'm going to show you some effective stretches to help get rid of a pinched nerve in your neck at home. This will be a little bit different than my typical videos where I say follow along exactly these exercises in this order for this amount of time. Cervical radiculopathy, or a pinched nerve in the neck, can sometimes be a bit tricky to help, especially if you're not sure what nerve root's involved. So of this stretch I'm going to show you, I'm going to encourage you to try them all and then gravitate to the ones that give you the most relief. I'm seeing so many more patients suffering from a pinched nerve in their neck, and the likely reason? We're sitting too much. We're not moving enough. We're slouching in front of our computers, sitting with poor posture, watching our TV. This puts pressure on our discs, which is probably one of the most common causes of a pinched nerve in your neck, is a disc bulge or herniation. Another thing that can cause a pinched nerve is degenerative disc disease or a bone spur or an osteophyte that might be pressing on a nerve. If you're under a lot of stress, tight muscles can also irritate or pinch a nerve, causing that pain to shoot down your arm. Clinically, we see this correlated with a neck that's out of alignment or not moving properly, so often these things go in conjunction with an underlying issue like a disc bulge herniation or degenerative disc disease. Before I get into these stretches, here is my disclaimer. If any of these stretches or exercises cause more discomfort, I want you to stop immediately. I also encourage you, before attempting any of these, to make sure you have an appropriate diagnosis. Without an appropriate diagnosis, you really don't know if the cause of your problem is treatable without professional help. So I encourage you to please seek out a proper diagnosis from your healthcare provider before trying any of these exercises or stretches. We're going to break these stretches into 2 groups. The first group are going to be general. These are the ones I recommend you try first and see if they give you any relief. The second series of stretches I go through with you will be a little more specific to specific nerve roots. How will you know if they're working? Well, your pain, your tingling, your weakness will improve. One thing you want to pay attention to is what we call centralization. Centralization is when the pain starts to move back to the center of your body or your spinal segments. If you are experiencing centralization or a reduction of the pain, and it seems to be focusing more and more centrally, you are on the right track. The first one, we're going to apply some traction. There's going to be a few variations, but just stay with me as we walk through this together. First thing you do, you're going to take your hands and you're going to cup them on the back of the occiput, and you're going to grab your thumbs underneath your mandible or chin. You want to be careful here if you have a jaw or a TMJ joint problem. You don't want to irritate that trying to fix your pinched nerve. So what we're going to do, we're going to take our hands, we're going to cup our head, and we're going to slightly traction, almost like a tricep extension. You're just going to very slowly increase the force until you get a comfortable feel. You're going to hold that for a minimum of 10 seconds. Try to make it up to about 30 seconds. You're going to do this 3 times. So for some that might find that difficult with the arms, another easy, effective way to do this is with a small towel or a pillowcase. Again, we're going to come behind our neck, just very simply extend up, really pull. And some of the variations here, for some of you might get relief when your head is in slight extension, but for some that actually might irritate the nerve. So if that irritates it, try to come into a little bit of flexion and pull up. Just change the angle slightly. Typically you'll have an irritated nerve on one side, so another variation of this is when you're tractioning up, just rotate to one side, oftentimes the side away from the irritated nerve. So if it's on your left, you're going to traction and just maybe a little bit more force. through the upper hand. So what you're doing, essentially, you're tractioning the neck and opening up the one side where those nerves come out. For this next one, I really like this one because it helps support the natural curve in the neck. We all know that a natural curve is important to keep pressure off the discs and keep the nerves happy as they exit between the two bones. For this one, you're going to need a rolled towel or a small pool noodle. So we're going to lie down. We're going to place the rolled towel or the small pool noodle right in the middle of our neck. So right away you start to feel some traction as that smooth curve is stretched and relaxed into the correct position. The addition to this is we're going to take our hands on the back of our head and our mandible, like in the first one I showed you, and we're going to gently traction while our neck is supported by the pool noodle or the rolled towel. This one we can stay on this pool noodle for, again, 10 to 30 seconds, 3 to 5 times with a bit of rest between each set. A modification of this, if you find that your rolled towel is not sufficient, come to the edge of a couch or a bed, and again, just use the weight of your head to traction into that cervical lordosis. What this does, this really works to open up the disc spaces in the correct alignment and helps take pressure off those nerves. The next general stretch I'm going to go through with you focuses on the scalene muscles. The scalene muscles are the muscles that run along the side of your neck, and the nerves from your neck have to go through those muscles to exit to go down the arm. Sometimes these muscles will be tight because you have an alignment issue, you're stressed out, there's been an injury, and this can irritate, pinch, or cause inflammation in the nerves. To do this stretch effectively, the first thing we're always going to do is make sure your head is over top of your shoulders. We don't want our head forward. As well, we want our shoulder blades pinched together. So we're going to assume that the irritated nerve is, say, on my left arm and it pain's going down my arm. We're going to pull our shoulders back, keep our head in neutral. We're going to lean away to pull down or depress this shoulder. We're going to take our opposite hand and pull slightly as we lean away. We're going to hold this stretch for 15 to 30 seconds before we come off and relax. Don't pull too hard here. You'll notice as you lean away and you're gripping the bottom of the edge of a bench or a chair or anything you can get your hand under, you're going to notice that you don't really need to reef on your neck. It's really going to open up the foramen where the nerves come out, and it's going to really stretch those muscles. Now that we've finished the 3 general stretches, we're going to move on to some more specific stretches. We call these nerve glides or nerve flossing. And so I'm going to show you a specific stretch for 3 main nerve roots. I'm going to show you one for the median nerve, one for the radial nerve, and one for the ulnar nerve. So this will be very effective if you know you have an entrapment or an irritation to one of those specific nerves. Just like our spine is designed to move in order to keep the discs healthy, the nerves are meant to slide and glide. These nerves need movement for proper blood supply, for fluid exchange, for nutrition. So these nerve flossing techniques help to maintain the movement within the nerves that are essential for them to heal and break up any adhesions or scar tissues that might be irritating the nerves along their pathway. So there are many modifications and ways to nerve floss. I'm going to show you the ways that I find pretty effective and quite easy to perform in the comfort of your home. The first one we're going to do is for the median nerve. Basically what we're going to do is we're going to take our affected side and we're going to place our hand palm down, and we're going to rotate the fingers back away as we drop our shoulder down. We're going to pull it up, and you might feel a band of tightness, so we're going to pull it up and we're going to hold that position. That might be all you need to do. To make it a little bit more effective, we're going to, as we flex our palm towards the front, we're going to pull our head away. We're going to do this nice and slow as we floss our nerve. And some of you might come back to neutral or come back over. See how it feels and really focus on keeping your shoulder down, getting that tight feeling, and really flossing that nerve. You're going to start off about 10 repetitions, 2 to 3 times a day. You can spread it out through the day if you like, but you don't want to work more than about 3 to 5 minutes on each of these nerve flossing exercises. The next one we're going to go through is radial nerve gliding or radial nerve flossing. This one, we're going to assume this affected side is the same, my right side. If it was your left, you'd do it on the left, obviously. Same thing, we're going to drop our shoulder down, okay? Keep that shoulder down, flex our hand, so almost like you're asking for a tip, okay? And then what we're going to do is we're going to slowly pull. You're going to feel that pull down the front here. So keep the shoulder down, and then we're going to come just like we were with the median nerve. We're going to extend as we laterally flex to the opposite side. Takes a bit of coordinating and practice, but that's okay. And again, you can start with 5 to 10 of these. Hold about a second or so at each end range as you floss the nerve back and forth. Again, you want to do this 2 to 3 times a day, working up to about 3 to 5 minutes total of work. 5 might be the upper limit, just to try to get this nerve gliding freely within the tissues. And now finally, for the final nerve flossing, the ulnar nerve. Again, we'll assume it's a right-sided irritated nerve, pinched nerve, cervical radiculopathy, and we're going to start by basically pulling our arm up to 90 degrees. We're going to look at the back of our hand, and what we're going to do is we're going to tilt and bring our hand in as we tilt our head to the hand. And then you can come back to neutral. Again, hold for 1 second or so at each end range. For a little bit more range, you can pull your head to the opposite side. And really, again, focus on keeping your shoulder depressed, your shoulder blades back. You come in and to the opposite side. So again, you work up to 5 to 10 repetitions of this, 2 to 3 times. You can spread it out through the day, never more than 3 to 5 minutes of each of these exercises. There are many modifications to these. Those 3 that I've shown you, though, I find effective clinically. After 18 years in practice, we've given all sorts of modifications. Those are, in my opinion, some of the easiest and most effective ones that you can do in the comfort of your home to get some relief. I really hope you found some value in that content, and some of the stretches, either the general or the more specific ones, is giving you some immediate relief right now. If you like the content, I'd appreciate it if you give me the thumbs up. And if you're new to my channel, I'd really appreciate it if you considered subscribing to my channel so you can be informed when I upload a new video. If you have a question or comment about the content of this video or any other videos, please leave it in the comments below. I will do my best to answer it as soon as possible. Again, I just want to thank you for tuning in. I appreciate your time, and I can't wait to see you in my next video. Until then, be well.